Deaths are heavily underreported in China. We learned this much from the World Health Organization's executive director, Dr. Mike Ryan, who in a statement says that the organization continues to appeal for more information from China regarding its ongoing COVID-19 surge. You see, China last month changed its criteria for what constitutes a COVID death, meaning only those who die of respiratory illnesses are counted. Pan American Health Organization and WHO representative for the Bahamas, Dr. Eldana Boysen, further explains.
WHO is working with the Chinese officials to help them to get a better assessment of their excess mortality.
This also comes as China's ambassador to the Bahamas, Dai-Ching Lee, assured reporters just last week that the situation in China is under control.
Some of you may have noted a resurgence of COVID-19 cases across China in recent weeks. China's COVID situation is expected and under control. Beijing is among the first cities to see infections peak, and life is coming back to normal. And provinces and cities across China are seeing infections peak to varying degrees. We are confident that we will be able to prevail over this latest surge reasonably soon.
But Dr. Boysen doesn't see it that way.
Well, I don't think it's under control anywhere because the virus is still circulating everywhere. So, I wouldn't say that it's necessarily under control in any country. We're learning how to live with it, is what we're doing or trying to do.
Health and Wellness Minister Dr. Michael Darville also recently doubled down on the decision not to restrict travel to and from China.
Our EOC and our team, our technical team at the ministry, still feel that there is no need to execute any major testing or restrictions for travel coming into the country. We are monitoring all the situations very closely at New Providence, at our ports, at our airports, as well as our family islands. And I can say that even though we're seeing some cases here at the Princess Margaret Hospital, there is no need for any major panic at this time or the implementation of any new restrictive measures.
Boysen adds that this situation serves as a reminder to other countries to ramp up their surveillance efforts,
so that they can detect new strains, to continue looking for cases, testing cases, because that's the only way we know that there's a new variant. And also reminding people that COVID is still here, in addition, of course, to flu. It's flu season as well. And that they should also continue to take care, especially if they have underlying conditions. If you're in crowded areas and so forth, to try and distance, try and use your mask, especially if you know that you're vulnerable.
Attempts to reach out to Dr. Darville for further comment were unsuccessful up to news time. Leah Cooper, Eyewitness News.